Hello, welcome everybody. Um, my name is John Hancock. I am the Associate Dean of Students for Health and Wellness at Lewis and Clark. I also am the Chief Psychologist, so I wear many hats at the college. And today I'm with you to talk about student health insurance. Um, it's a funny thing. I think most of us kind of think of student health insurance as a relatively boring topic. But I checked with one of our facilitators today who was setting up the webinar. I think we have over 100 people who are scheduled to be in attendance. So I know that even though insurance can be not a very fun topic to talk about, it's really important, especially in these times of COVID. And I know many of you have lots of questions about insurance. So we'll get to those. But I do want to welcome you all. Again, I said this in the webinar that we did on more broad health and wellness issues on Wednesday. I wish you were all here so that I could see your faces and kind of be in the room with you and experience that energy. But my co-presenters and I will do our best to do this via Zoom. So I'll let them introduce themselves, but I'm excited to have them with me today. For the most part, it's really going to be myself, and it's going to be Mike Pigou from USI Northwest. And then someone from our student accounts office, Sherry, will be joining us at the end for the question and answer sessions, but I'll let them introduce themselves more when the time comes. So a couple housekeeping things as we get started. Today's session is scheduled to last an hour, and we have received questions from people in advance. Thank you to those who've submitted those questions. We did try and create our presentation so that we actually answer a lot of the questions that you've already posed as in the context of our presentation. But if we go through the presentation today and there are questions that we don't address, please feel free to use the Q&A feature at the bottom of your Zoom screen and put in those questions. And then Sherry, part of our presentation team, will be assisting Mike and I with questions at the end of the kind of last section of today's program. So yeah, I want to make a couple comments just about the context of today's presentation. These times are like nothing I've experienced in my life. And I don't know what all of your lives have been like, but these are very peculiar and different and challenging times. And I know when it comes to employment security, I know when it comes to the security of health insurance, these are huge issues for us, both in terms of our physical wellness, but also in our emotional wellness. I believe the audience in today's webinar is almost exclusively the parents of new students. If you are the parent of a returning student, that's great too, and we're happy to have you with us. But I know I've in the last few years, I've sent two children off to college myself. I know what some of that apprehension was like even before COVID was around. And I know you want to be sure that they have adequate health care and health insurance when they're with us. So I think what we have to talk about today is really, really important. And we'll do our best to answer your questions. Henry, if you could advance the slide, please. So I thought I would start by talking a little bit about the difference at Lewis and Clark between the student health service and student health insurance, because people get these things confused all the time. In fact, the most common question I get is, if my student doesn't enroll in the student health insurance plan, can they still use the health service? And the answer to that question is absolutely. We do have an on-campus health service. The director of that health service was part of our presentation panel on Wednesday of this week. And she talked about the different services that the health service offers. So certainly this year, we're going to be doing a lot of assessment and treating of respiratory illnesses. Most respiratory illnesses that we see in our clinic this year will not be COVID, but we expect we'll see some COVID in our clinic. So we've actually created two separate clinics for the health service this year, one for respiratory illness, one for many other concerns that a student might want to come in and chat with us about. The health service will also be doing some telemedicine this year. In fact, that's probably going to be our point of entry for many of our services, but we'll certainly have plenty of face-to-face care too, depending on the student's needs. So all students can come in and use the health service regardless of what their insurance plan is. And the good news about the health service is that all of the provider visits in the health service are free. So most of our providers are nurse practitioners. We do have an internal medicine physician who works with us part-time. We also have a part-time psychiatrist. Now that is the exception. Our psychiatrist works with us just a few hours a week. We really reserve her for people who really need to see somebody on campus and are unable to get off campus. But there are some modest fees for psychiatry. But with the exception of psychiatry, all of the provider visits for the health service are free. All the care there is confidential. But we do charge for some things in the health service. So for example, for labs that we run, some of those we do in-house, some we send out. We don't have a full pharmacy, but we do have a limited supply of medication in the health service. We also have some different equipment items, and there are also certain procedures that we do. For example, I'm not exactly sure if we'll be doing it this year or not. We haven't had this conversation yet, but I know in the past in the health service, my colleagues there have done what they call Wart Wednesday, where they burn off warts. And because we use some supplies to burn off warts, there are some charges for that procedure. So there are some charges for some things in the health service, but actually provider visits are free. And that's a really nice feature. We also do charge for no-shows in the health service. And just as a reminder, anytime a healthcare provider charges for a no-show, that's not covered by any insurance plan. But what will happen is if a student is ever charged for something in the health service, they will be able to go into the health information portal and print out a walkout statement that shows the charges to them. Those charges will be moved over to their student account. And of course, the college desires for students to make payments on those accounts relatively quickly, but there'll be no cash being exchanged. There'll be no checks being written in the health service. We don't collect any kind of fees at the point of service. And again, provider visits are free, but those few things we do charge for, we don't collect money at the time of service. Now, once a student prints their walkout statement out of the health information portal, they can submit it to their insurance. Now, we'll talk about the relationship between our student health insurance plan and the student health service, because we've got a really great arrangement which results in the fact that, generally speaking, the student health insurance plan will reimburse at 100% for most everything that's charged for in the health service, right? But if you don't have the student health insurance plan, the health service will wind up being an out-of-network provider for just about every other insurance plan that's out there. So students can always submit their receipts to their insurance company, but if they're on the student health insurance plan, those are going to be processed in a certain way that results in a very good reimbursement, typically 100% reimbursement with no deductible and no co-insurance and no copay. But if you have other insurance, then those are going to be processed as out of network for the health service. So hopefully that helped you understand some of the differences between the health service and the student health insurance program. Henry, next slide. So I want to talk about next is, why does Lewis and Clark even have a requirement for health insurance? Not all colleges have that requirement. Well, I want to share with you, I've been in college health since 1986 doing something or else. And I've been in a leadership role in college health since 1984. And I know that, students, sometimes they have this sort of, especially at this age of 18 to 22, 23, something like that, they have sort of this myth of invincibility going on, that they can ignore big things that are happening with their body, that someone who's older, my age, or the ages of our people who are listening in today might tend to, they might go seek medical consultation for. So what we have found is that students who have health insurance are more likely to get the medical care they need to keep themselves healthy and safe. Our director of athletics tells me a story from the past where he had a student who had a condition that had arisen, and quite literally, the condition was life-threatening, but the student didn't want to go and access any health care because of the concerns about the finance of it, and they wouldn't have the insurance that would work in Portland and wouldn't cover their needs. So we believe that the best way, one of the barriers we can reduce to students getting the care they need to stay healthy and safe is to be sure that all students have health insurance. So that access to care is so important. So that's one important reason why we require all students to have health insurance, all of our undergraduate students to have health insurance. In addition to that, a healthy student and a safe student is likely a student who's also continuing their academic progress. And getting students through Lewis and Clark as quickly as their curriculum and their desires will allow is very important to us. So we want to support students' academic progress. And finally, we want to reduce the need for medical withdrawals. When a student withdraws, there are different refund dates in the semester according to how much money you get back if you withdraw at a certain time. So if you withdraw, and let's say there would be a medical crisis and you withdraw on day 2 of the semester, that's a very different refund situation than if you withdraw in the 15th week of the semester, right? But the point is that there are plenty of students, and we see this every year, where something medical will arise. And if they can get the care they need in Portland, they're able to do the physical therapy they need, they're able to do the psychotherapy they need, they're able to get the MRI or the x-rays or the care they need, and get it in Portland and continue their academic progress in their classes, as opposed to having an insurance plan that doesn't work in Portland, in which case sometimes they would have to go home. And in a typical year when we weren't doing remote learning, they might have to actually give up on the semester entirely. So these are some of the reasons why we do have that requirement for health insurance. Next slide. Alrighty. We do automatically enroll all students in the student health insurance program, but it's really easy to waive out of the student health insurance program as long as your other insurance program, typically, oftentimes for our undergraduate students, it's a plan through a parent or a guardian, sometimes a partner or a spouse. If they have another plan in place and that plan meets these basically 4 criteria, if it provides access to care in Portland or in the area where the student is studying. Now, typically that last phrase, the area where you're studying, applies to our students who are studying abroad. But this year, our students are going to have the option to study remotely. And so if they have the availability of care in the area where they're studying, then that meets this particular criteria. Now, one clarification, and this really mostly focuses on students who are coming with us in Portland. If you have an insurance plan and your student is coming to study in Portland, and the only coverage your plan allows is emergency and urgent care, and that's all it covers in Portland or the greater Portland area, that's not going to meet our criteria. And the reason is because if a student comes into our health service, and let's say our staff are evaluating the student and they detect something a little bit going on that causes them concern, and let's say they want to refer them for evaluation by a cardiologist or an orthopedic surgeon, or you name the specialty, a urologist, or really any specialty at all. Those plans are not going to cover that, and those students are likely not going to get those services. Maybe it's an MRI or some other diagnostic test that the student needs. Maybe it's a biopsy the student needs. So they're not going to get those services if all their insurance covers is urgent and emergent care. So that's why we want them to have access to a range of care and not just urgent and emergent care in Portland. It's important that plans also include mental health benefits, inpatient and outpatient, have at least $500,000 in coverage, and that the coverage be in place for the entire year. If your plan meets those criteria, then you can waive out of the student health insurance plan. And we have lots and lots and lots of students who do that. It's a pretty easy process. Next slide, Henry. So to waive out of the student health insurance plan, well, actually, let me go back one step and say this. Our student health insurance plan is it's a benefit-rich plan. We've designed it to be that. We've designed it to provide care that students can afford and that they're likely to access. Every year, we have a group of students, faculty, and staff who evaluates our student health insurance plan and considers what benefits we want in the plan for the coming year. And students are consistently actually very satisfied with the plan and with the benefits it offers. As you'll see when Mike talks in a little bit, relatively low deductibles compared to plans in the employer marketplace, and really solid benefits too. So we think it's a good choice, especially for students who are studying in Portland. But if it's not, that's okay too. And so this is the website for the student health insurance waiver. And it's actually the website for our entire student health insurance website. So if you go to this page, go.lclark.edu/student/health/insurance, at the very top of that page, we have a little paragraph. It includes a link to the waiver. And the waiver is very easy to complete. It only takes maybe 10 minutes, something like that. You attest that your insurance meets those other criteria. You enter your insurance information into the system, and then essentially your waiver is processed. Now, the bill for student health insurance does go on students' kind of master bills with the college. So if a student waives out of their student health insurance coverage, they want to be watching their bill, because typically what will happen in a matter of days, the charge for student health insurance will just disappear from their bill. And so that is the way you can be 100% sure that the waiver has actually gone through and everything is completely in order. If for some reason, and it really doesn't happen very often, once in a blue moon it happens, where a student has completed the waiver and the charge doesn't get removed. If you see that that's happened and the charge is still there, then please be in touch with our student accounts office. Sherry will talk a little bit more about that office a little bit later. And they'll be happy to look into the situation for you and make sure that the charge is taken off, given that the waiver has been appropriately completed. Now, there are some other questions I get routinely about waiver issues. One of them is, well, what if I have Kaiser HMO sort of coverage, or maybe other HMO coverage? And really, the issue with all coverage, right, HMO or PPO plans or whatever it might be, is that we want them to meet our criteria that I outlined in the previous slide. And all that criteria, again, is on our waiver form. But the interesting thing about Kaiser in Portland is their facilities are a little ways from campus. And so, in fact, gosh, if I was driving to a Kaiser facility from Portland, depending on the time of day, if I was driving myself, I would think a minimum of 30 minutes drive time to get to any of their facilities. And in rush hour could be significantly more than that. And if I'm taking a bus or other light rail or other mass transportation, it might be longer too. So what I would encourage you to do is, if you're thinking about keeping and also this relates to pharmacy issues too, because for Kaiser, I have not had Kaiser coverage personally in my life, but I do believe that they want a lot of their pharmacy run through their pharmacies. We have pharmacies close to campus, but they're not the Kaiser pharmacies, right? So what I would encourage you to do is go to this website, and it's on this slide. It's called www.trimet.org. And you can look up the Kaiser locations in Portland. You can see where the campus is from those locations. You can see exactly how long it would take to get there on a mass transit, because this is trimet.org is our mass transit trip planner for Portland. And then you can decide whether you would want your student to be in that situation. We have a fair number of families each year, so you can contact Kaiser. You can get guest, if you have Kaiser from out of state, you can contact Kaiser. In some cases, you can get guest privileges in Oregon. And if you get guest privileges in Oregon for Kaiser, then you can waive out of our student health insurance plan. So I just want to be clear about that, because I know it's kind of confusing. Kaiser coverage, when you get guest privileges in Oregon and it works in Portland, it generally does meet our criteria. So you can use that insurance and you can waive out of our plan and you can save that cost. However, just because you can do it doesn't mean you should, because again, there's going to be that hassle of actually getting to a Kaiser facility, maybe when your student is not feeling well, right? So of course, we do have the health service on campus, and in the health service, we offer the free provider visits, right? We do, primary care. We do some urgent care there. We do reproductive health care, a few other things, illness and injury. we treat in our health service on campus. But if a student needs anything more specialized than that, then we're going to be sending them out. And if all they have is Kaiser coverage, then they're going to have to find a way to get to a Kaiser facility. So that's something to think about if you have Kaiser coverage. Now, especially this year, things are a little different with COVID and also with the remote learning situation. So for example, we have international students really around the globe, or we have actually some US citizens who may well be doing their remote learning from abroad. And it might be that you feel like your plan doesn't quite meet those comparability criteria that were on that previous slide. But you'd still like to make the case that your coverage is adequate, right? So if you go to the waiver website, it's pretty cut and dry. In other words, you have to say yes or no, whether your insurance meets those 4 markers for comparability. If it is, you can proceed with the waiver. But if you mark no to anything, it will basically reject your waiver attempt, right? But I do know that there are, all kinds of different interesting situations and very difficult and challenging situations that families are in right now. And so if you feel like your plan, if you are studying in Portland, then your plan is really going to need to meet those 4 criteria, because that is, we know those 4 criteria work really well in Portland for assessing the adequacy of health insurance. But if you're remote learning this year from another site, and you have other coverage, and it sort of meets our criteria, but doesn't completely meet our criteria, what I'd like you to do is send an email to a colleague of mine. Her name is Marjorie Reedy. Her name is on this slide, and you can reach her at mreedy@lclark.edu. And if you'll explain your situation to Marjorie, she will send you a special waiver form in which you can kind of explain your special circumstances and how your plan doesn't quite meet our criteria, but how you'd like to waive out of it anyway. So that's what to do if you're studying remotely and you kind of, your plan doesn't quite qualify for our standard waiver criteria. The other question I get with some frequency is, will my out-of-state Medicaid meet the college's requirements? And the answer to that question is, if your student is studying in Portland, the state of Washington, right, is right across the river from us. Now, I say right across the river, it's right across the river from Portland. But to get to the state of Washington from campus, I would allow probably 40 minutes in good traffic, and maybe an hour or more in bad traffic. So it is, again, hard to reach. But if you have AppleCare, which is the Washington Medicaid program, we do count that as meeting the college's comparability criteria, because the Vancouver, Washington area is part of the greater Portland metropolitan region. And so for Washington State, your out-of-state Medicaid will meet the college's requirements if you're studying in Portland, okay? If you're studying, of course, if you're studying in Portland and you're coming from any state other than Oregon or Washington, and you have Medicaid, your Medicaid is only gonna cover typically emergency care in Portland, and that's not going to be adequate. So what we do in those situations is we want to help your student transition from their out-of-state Medicaid program to the Oregon Health Plan. That is a transitional process. It usually involves relinquishing the student's out-of-state Medicaid in order to get on the college's plan. That can take some time. I want to tell you all that we are very supportive and flexible with students. My next slide, I'm going to talk about the deadline for all these waiver things to complete. But know that if a student needs to transition Medicaid from another state, whatever that state that might be, to Oregon, we're going to allow them extra time to make that transition. We just need see a good faith effort on their part to be making that transition. And if they're in touch with us, and if they're making that good faith effort, then we will allow them plenty of time to get coverage on the Oregon Health Plan. And I have found that lots of students can make that transition effectively. So if you have questions about eligibility for Oregon Health Plan, I would encourage you to just sort of Google Oregon Health Plan on on your search engine, and you can direct questions about Medicaid eligibility in Oregon directly to the Oregon Health Plan. One other thing about out-of-state Medicaid. If your student is studying remotely this year and they have out-of-state Medicaid, that's going to be just dandy because that's going to provide them the care in the area where they're studying. So they are going to meet our waiver criteria. So if they're studying out-of-state remotely and they have Medicaid from that state where they're studying, they can fill out our online waiver. And for this year, it's going to be just fine. Next slide, Henry. Okay, so I've only got a slide or two left. I want to say that underscoring this, so all students automatically enrolled in and charged for the student health insurance plan. The cost is $1678.50 per semester. You pay that in the fall and you pay that in the spring. And it's the same amount of money in the spring. The spring charge includes summer coverage. So essentially, if you take $1678.50 and you multiply that times 2, you get a premium of something around $3,500, and that is a premium that's worth 12 months of coverage, just to be clear. So it is a year-around plan. Now, all students are enrolled in that, and it's billed to their student account. If a student has that comparable coverage, they want to decline enrollment, they have to complete that waiver that I was talking about by September 14th this year. And that's their only chance this academic year to decline enrollment, right? So there is not a comparable process unless a student is going abroad or some other special circumstances apply. We'll talk about special circumstances later. For most of our students, this is their only chance to waive enrollment. Now, every year, we'll have some students. Now, students, when I was 18 or 19 years old, did I really think much about health insurance? No, and I bet you didn't either if you're a parent. But it's really important to think about it because if they don't waive out of the coverage, this is going to be a charge on their account and it's going to stand, and then you're going to learn about this maybe in October or November, and you're going to come to myself or to Sherry in our student accounts office. You're going to say, well, we didn't want the insurance. Well, the challenge then is that the student has already enjoyed several months of benefits of the insurance. Maybe they used it, maybe they didn't, but we're not going to be able to refund all that money for something the student has already had the privilege to use. So be sure your student, if they want the insurance, there's nothing they need to do because they're automatically enrolled. But if they don't want it, they need to waive by September 14th. Next slide, Henry. Okay, and last thing I think I have before I turn it over to Mike. So that waiver process that I've talked about happens at the start of each academic year. So just because you do it this year, it's not good for 4 years. So students need to do it. Every summer it opens in mid-July. It closes in mid-September. The exact date changes by just a few days each year, but it's always open for about a 2-month period. So students are reminded about this, and we encourage parents to remember too, just to kind of put it on your annual planner to fill out that waiver if your students don't want the coverage. As I say, the plan's a good plan, but it's not for everybody, and we respect that. The last thing I'll say is if a student loses their coverage with another health insurance policy at some point during the year, so let's say they're covered under a parent plan, the parent loses their employment, or let's say the parent gets married and there's a switch in coverage, something like that. These are qualifying life events, and the student can be added to the student health insurance program at a midpoint, at any point really in the semester, if there is one of those qualifying life events that happens, okay? So if your family, may none of you experience that sort of thing, but I fear that some of your families already have. These are difficult times. But if anything like that happens, we want to know that we will support your student in getting onto our student health insurance plan at a midpoint with a qualifying life event. And that can all be done through the Office of Student and Departmental Account Services. That's all I'm going to say, and I'm going to turn it over to Mike Pigou. Mike is with USI Northwest.
John, before we move to Mike, could we take a couple of quick questions that I think you can easily answer for us?
Yeah, absolutely, Sherry, sure.
So the first question is there a separate student health insurance for student athletes?
Yes, so there is a student health insurance policy for student athletes, And no, I said that wrong. There is a health insurance policy for student athletes. And we don't have anybody on our panel today that can speak to the sort of the nuances of that plan. Um, but what I would encourage you to do, if your student is a student athlete, I would be talking with the coach for the sport that your student is associated with, or there are a couple of athletic trainers. The head athletic trainer, his name is Jeremy Lowe, and Jeremy works directly with the benefits of the health insurance program for student athletes. Those benefits are not as comprehensive. They tend to be more sport focused, right? So if there's an injury playing the sport. So I would talk with Jeremy about the benefits for the insurance program for student athletes. And then also continue to listen to today's program, because this is that more comprehensive umbrella policy that will cover much, much more than that will cover.
Great. We have a couple of other questions for you. One is there a benefit to having double insurance, private insurance plus the Lewis and Clark plan?
Well, I'm gonna answer that, and Mike, maybe you could chime in, or maybe when you go, you can talk about it. I've had double coverage a couple times in my life. I've loved it. I've loved double coverage, because then especially once you clear maybe the deductibles of your plan, and the plans are working together, you wind up having no co-insurance and sometimes no copays for anything. So it's a wonderful thing. It's all a matter of how much it's costing you to get the double coverage, right? So there can be advantages to having double coverage, but there are also the costs associated with the premiums. Our plan is built to be a plan that has a pretty low deductible. It's very affordable in terms of copays and co-insurances. And so for a lot of families, they actually find, once they look at the benefits of our plan, and Mike will speak to those benefits, that our plan is sufficient and adequate. And Mike is going to talk about the portability of our plan, because it is quite portable. So for a lot of people, they don't need double coverage, but certainly some do have it.
Okay, next question, and we're getting this kind of asked in a couple of different ways, but if a student chooses to do online in the fall, and then they return to campus in the spring, could they decline it now and then pick it up in the spring? And then it's also kind of combined with, can they purchase it for just one semester?
Right. So those sound a lot alike, but I'm going to discriminate a little bit between the two of them. So historically, Lewis and Clark has, we pride ourselves in providing a high quality in-person liberal arts education. And sometimes that's in Portland, sometimes it's abroad. Historically, for students who are doing study abroad programs, we do allow them at the semester point to make changes in their coverage, because we know, for example, a student might have coverage through their parents that maybe works overseas but doesn't work in Portland, or works in Portland but doesn't work overseas. And so we do allow students who are changing their geography at the semester typically to make changes. And I'm just going to say this year we'll do the same for students who are distance learning. If we have a student who has been remote in the fall and they've waived, and if you'll be in contact with me, if the student be in contact with me, let me know about their desire to get on the plan before January 1st. Please be sure I know about it. We will find a way to get them enrolled in the plan for the next semester. So if there's a change in geography, right, about like distance learning, right, so New York to Oregon, or California, Oregon, wherever it might be, we can work with students on a mid-year change this year because of the challenges of distance learning. But those people aside, let's just say a student who's studying in Portland with us all year, they do not get a chance at the semester point to make a change unless they've had one of those qualifying life events that I mentioned earlier. Sherry, was that clear enough for you? Do you think, it's without any feedback from the audience, I just want to be sure that I'm being clear enough.
I think that was good. Yes.
Excellent.
And the last question for you, and then we'll move on to Mike and then maybe do some more questions at the end. But is Student Health Services going to offer flu shots again in the fall?
Yes. So we have ordered some flu vaccine. I think it's already been delivered, although maybe it won't be delivered till later this month. I can't be 100% sure of that. But we'll have some supplies of flu vaccine in our clinic. Also, we're working with outside vendors places like Walgreens that have and Safeway Pharmacy. Each year we look at different vendors who can come to campus, do flu clinics for us on campus. So typically it's a mix of those different ways. But yes, we will be offering flu vaccine on campus this fall.
Great, thanks, John. I think we're ready for Mike.
Cool, thanks, Sherry. Thanks, John. So my name's Mike. I work for USI, and we are the consultants for Lewis & Clark for the Student Health Insurance Program. So today, I'd like to touch on the benefits as well as the Pacific Source Network, the Lewis & Clark Health Service, some COVID updates, and then we'll run through the FAQs. So thank you to those that posed some questions prior to this call. So just starting with the health plan, the cost, like John said, to echo that, it's split into 2 semesters, but if you did enroll for the fall, you are covered for the entire year, and that will be the annual cost of $3,357. If we look at the benefits at a glance section of the slide, so the contract year deductible, so that's the academic year. For in-network, that's $500, and for out-of-network, it's $900. And then the out-of-pocket max is $3,500 for in-network, and then $10,500 for out-of-network. And then your plan maximum is unlimited. So just to touch on these areas a little further, so I would like to call out that the in-network and out-of-network accumulate separately. So it is really important that you try and find in-network providers as often as possible, because if you do have to satisfy that $500 deductible, you might do so and then only be subject to co-insurance or co-pays. But then if you see an out-of-network provider, you'd have to satisfy the $900 deductible if it applied to the service. All right, Henry, next slide, please. So here we'll do a overview of your cost shares. So we've got 3 columns reading left to right. We've got the services, and then we've got your in-network provider costs, and then your out-of-network. So for routine physicals, immunizations, well-woman visits, it's no deductible, and the member pays $0. So there's no copay, and it doesn't affect that $500 deductible. Whereas if you saw an out-of-network provider, it would be subject to that deductible. So you'd have to satisfy that $900, and then you'd be subject to 40% of whatever the service may be, and the insurance would pick up 60. So you can see there's a big difference between seeing an in-network provider and one that is not within the network. So if we go down to office visits, we've got a $20 copay, no deductible. It's quite standard for out-of-network. It's all towards the deductible and 40%. So I'll just run through the in-network for some of these. Urgent care, also $20. Specialist office visits, again, no deductible, $40 copay, which is great. And then probably the best benefit of the plan, which we know this is really important within universities and for students to access, is mental health office visits. So whether that's in or out, we're able to do a no deductible $20 copay. And that's great because, you know, that it's quite hard to find in-network providers sometimes. So this is just blanket, whether they're in or out, it's going to be that same $20 copay. Then you have your outpatient rehabilitation services. So again, it's the $20 copay. Moving down to inpatient or outpatient surgery, and then your advanced diagnostics. So that's like an MRI. You've got the after deductible. So you'll actually have to satisfy that $500 first, and then you pay the 20%. So just using a straightforward example, say it's, you know, the 15th of August and you haven't used the plan at all, and you go in for an MRI and that's $600, you'd have to pay the $500 towards the deductible first, and then the plan would pick up 80% of that remaining $100. So the total cost would be $520. Now, if you'd already satisfied the deductible, you'd just be paying 20% of that $600. And then looking at the out of network, again, you'd have to satisfy the $900, and then it would be the 40% that you'd be up for, and the insurance would cover $60. And then for labs and radiology, so there's $0. The member has to pay between the first 0 to 400. It's free, and then from that point, it'd be 20% again after the deductible. Whereas if you go out of network, it's 40% and then the higher deductible. For emergency room and ambulance, there's no in or out of network for these. So it's a $200 copay for emergency room. And then after, for the ambulance, it's you have to satisfy the deductible, and then it's 20% of that cost. And then you've got your chiropractic and acupuncture, $20 copay, which is great. And then down to prescription drugs. It's tiered out into 4 sections. So you have your tier 1, which is $15, tier 2, $30, tier 3 is $50, and then you've got the specialty drugs, which are tier 4, which is the $75. And there's some great links where you can actually access the prescription drug list and see what your medication or scripts might actually fall into on that category. And then down the bottom, as John said, Lewis and Clark Health Service, covered at 100% for the most part. Henry, would you mind? Next slide, please. All right, so we'll talk about the network. So for those that are new to the plan, you'll see that it's called Voyager. That is the network for Pacific Source, previously called PSN. And this is just a rebranding. You may see PSN or Voyager when you're going through their website, and this is just due to the transition of rebranding. So either or, that's the network if you're within Oregon, Washington, Idaho, or Montana. And then through their partnerships, if you're outside of those 4 states, and outside of Alaska, you'd be accessing the First Health Network, which is great. You can access your benefits, anywhere in the country. And then if you are in Alaska, if that's your home state, so you're going back for, see your parents over Christmas break or, winter break or summer break, you'd be on the First Choice Network. And then you'll see here in orange, there's the link to find a doctor. And this is also if you want to find a pharmacy, urgent care, anything like that. You can put in your network or where you are, put in your zip code, and then you can really drill down and find a provider based on that within 1 mile, maybe 2 miles of your area. So really nice. And just a final point on that piece, while Pacific Source try to keep their online search up to date, things do change. So we always recommend calling ahead and just making sure that both the physician that you're going to see and the provider are both in network to avoid any out of network costs. Henry, thank you. So the health center, so as John said, what's covered? Services are covered at 100%. As John also said, they do have to send labs out sometimes. So lab referrals are covered at 100%. Lewis and Clark has a partnership with Quest Labs, and charges should be billed on the walkout statement and then reimbursed at 100%. So if the student then submits the walkout statement to Pacific Source, it would be reimbursed. And then touching on the rapid testing, as John said, that is going to be available at Lewis and Clark as well and covered at 100%. And then again, just stressing the walkout statement and just making sure that it does get turned into Pacific Source if you would like for those services to be reimbursed. And students can access these walkout statements on their health information portal. Henry, next slide, please. Okay, so COVID. So I'm not sure if you're currently aware of the Pacific Source, and a lot of insurance providers have extended COVID benefits through August 31st. And obviously that's coming up pretty quick. So Pacific Source senior leadership are actually meeting on the 5th of August to discuss extending that timeline. And I'd expect we'd have an announcement pretty shortly after that meeting. And given the current environment, I'd imagine it's highly likely that would be extended. Although, nothing's been confirmed yet, I would think it'll be pushed out quite a few months. So what does this mean? Pacific Source will continue to cover teledoc visits for any diagnosis with a $0 copay. COVID testing and diagnostic services, Pacific Source will cover with a $0 member cost share for any in-network provider. So that coverage includes both diagnostic and antibody testing. Diagnostic services can be telehealth, in-person, outpatient, inpatient, ER. If it has COVID in the diagnosis on the claim, it'll be paid at 100% for in-network providers. And then for the out-of-network providers, Pacific Source will cover claims at 100% based on the allowed amount. So slightly different. With the in-network providers, Pacific Source has arrangements or contracts with them for basically an allowed amount that they can bill for a service, whereas outside of the network, that's not always the case, or isn't the case, sorry. So Pacific Source will pay up until what they deem is reasonable or that allowed amount. So if you do access services out of network, there could be a difference, like a balance bill that the student or member, would be having to pay. So again, really important to access your in-network benefits. And then for up-to-date information, Pacific Source has a blog on COVID, and the link here is provided at the bottom of the screen, which has some great updates and information just on, things you can do to help, not spread or contract COVID, as well as just updates on testing, some really great information.
Mike, can I jump in with a COVID question real quick?
Yeah.
I'm being asked that if my student meets the waiver criteria, so they do not have student health insurance, Lewis and Clark's, but then the school tests them for COVID, who will pay for the cost if they do not get to go to their usual provider?
Okay. So they don't have the Pacific Source insurance?
Correct.
Great. I might have to defer to you on that one, John. With that, it would just be,
Yeah, so I'll say it, and I don't have a super easy or super clear answer. If a student comes into the health service and it's clearly a symptomatic test, they're ill, they're getting tested, there are going to be charges for testing. We do not have the rapid testing equipment yet, but we have every indication from our vendor that we will have it by September 1st. So anyway, we hope to do COVID testing on campus. Until that time, we have to send it out. When we send it out, or when we do it in-house, we still incur charges for testing. So if a student is symptomatic and comes in, that charge is going to get assessed to their student bill. And if they and then they can choose to submit it to whatever insurance they have for reimbursement. If they have the student health insurance plan, it's going to be reimbursed 100%. But if they don't have the student health insurance plan, it's going to be reimbursed according to the rules of your other insurance plan. Now, the college is discussing surveillance testing significantly, testing for asymptomatic individuals. And I think you're going to find a lot of variability in the community. If someone goes in for asymptomatic testing in the community, how is that coded by the people who are doing the testing? And then how is that processed by the insurance company? That depends on kind of how your insurance is set up. So we have more than probably 200 different student more than 200 insurance plans that are represented in our student population. So I don't know how they will manage asymptomatic testing off campus, but that's something to think about. The college is working diligently to come up with the plan around surveillance testing, including the finances of how that will work. We don't have those answers yet, but I am optimistic that we will have them before the start of school. So I would just say we will be in touch with people about that surveillance testing plan and also about the financial aspects of that as time goes on.
The follow-up to that, John, is can they decline to be tested and get it done at their usual provider? And that same person is stating that if we're going to test asymptomatic students, wouldn't the school pay for that?
Yeah, so that's currently in discussion. So in terms of whether we're going to, whether the college will be paying for asymptomatic testing. So again, there's a lot that's going on in the testing realm. Part of it involves us developing agreements with external labs because while we can do some of the rapid testing on campus, the rapid testing machines can only do 4 tests an hour. We hope to have 2 of them by the start of school. That's only 8 tests an hour. We can't, do surveillance testing of the entire population of 2,000 students and all do it within our campus testing sort of capacity. So we're going to have to use external labs for that. We're working out the agreements with external labs right now. I was working on that earlier today. So there'll be more answers about that question, in the coming weeks. But what was again the first part of that, Sherry? I don't think I answered the first part. What was that again?
Could they decline to be tested if they knew they could go to their own provider?
Yeah, I would say that in general, we're going to try to be flexible with students. If they got a provider off campus and that's where they want to get their testing done, that's fine. When we get to the point of requiring testing, and there are individuals for whom testing will be required at the very beginning if they can't do their 2-week self-isolation period, those people can be tested off campus and they can have those results submitted to our health service, and that's adequate, yes.
Great. I know that we only have about 6 minutes left, so we want to get through Mike, his slides, and then we'll continue questions at the end.
Oh, thanks, Cher. So just on to the FAQs, and again, thank you for everyone that submitted these questions prior to the call. So first of all, is the student health insurance comprehensive? And yes, it is. It is a very good plan. Plan offered is ACA compliant and covers all essential health benefits. And it's rated as a platinum level plan for those that are familiar with the metal levels of ACA plans. So in terms of what you pay and the benefits you get, it's very, very strong. Does the plan coverage last for 12 months? Yes, it does. It runs for 12 months, and that's for the full academic year. And sorry for reiterating this, but it is split by semester. The spring is for those new students that are new to campus, and they have the option to hop on the plan for the spring. And then for anyone that has a qualifying life event or QLE, so parents lose coverage or they turn 26, age out of the plan, they're allowed to hop on at a prorated rate depending when they hop on to the Pacific Source insurance. Next question, will my child be covered when he is at home back in our state? So yes, it won't be under the Voyager network. You'd be under the First Health if you were in Minnesota. And again, we'd recommend using the Find a Doctor, Find a Provider link on the Pacific Source site to find a network provider. So the next question, I received notice of hospitals that were dropped by the plan. Can you instead tell us what is close by, what is covered, and in case of needing hospital urgent care? So sure, so Voyager includes, but not limited to Legacy Health, Legacy Health Partners, the Portland Clinic, OHSU, and then urgent cares such as Zoom, Legacy Go Health. They're all in network. So, and again, stressing the Find a Doctor search, it's great. where you can drill down and find any providers kind of within, a couple mile radius of your location. And then I think this one was covered, John. Can you buy one semester of health insurance? So no, not typically. If a student waives for the fall, they've waived out for the entire year. And then if you are in for the fall, you are in for the entire year, unless you have that qualifying life event or a new student to the college for the spring. Henry, next slide, please. Cool. So does the student insurance cover student medical expenses off campus? Yes, it does. And we have those range of networks again. The student health insurance also covers students that are abroad, although unfortunately I don't think that will be happening anytime in the immediate future. But it is a comprehensive plan that does cover the student wherever they are. And then we did touch on the deductibles and copays, but just for your reference again, and if you would like further details, I know we just did an overview of some common services, but if you use the link below, you'll be able to access the summary of benefits or the student handbook, which goes into a lot more detail on covered services. And I believe that the Lewis and Clark website also has a links to the Pacific Source page, so you can access it from multiple sources. And then finally, we have, sorry, Henry, next slide, please. Just those useful links that I touched on, which will be available. I believe this will be posted after our meeting, our conversation. So thank you.
So there are several questions. I recognize that we have about 2 minutes left, but there's been a couple questions about, will this be available? Some people who joined late or maybe want to watch for some other things again. My understanding is it will be available on the NSO parent website. Is that correct, John?
Yes, it is, Sherry.
Okay, so people can certainly look for it there. John and Mike, are you okay to take some questions and get through as much as we can, or do we need to cut off right at 5?
Sherry, I guess maybe you could guide me. Maybe I might want 1 minute. We did start a couple minutes late, so I think we probably could go another 3 minutes.
Okay.
I'd probably like about 60 seconds to wrap up. So are there any questions in your mix there that we could address in 2 minutes or so?
Well, I think this is kind of a follow-up question to the student athlete one. If there is a different insurance for athletes, do they opt out of the Lewis and Clark insurance?
Yes, and so again, the student athlete insurance is a very circumscribed policy that really, and I'm sorry for not being more of an expert at it today. And I don't want to misspeak. When it comes to insurance issues, the devil's always in the details. So I would encourage you to just follow up with athletic staff to better understand what is covered and what's not covered. The last I researched that plan, for example, again, an illness, injury that occurs on the basketball court, right, was going to be covered. But obviously, if they're walking down the street and they, fall and break an ankle, right, that's not sports, so it's not going to be covered. So check in with your sports medicine staff, your athletic training staff, your coaches to better understand the sports policy.
And then there's a couple of questions, John, about mental health services on campus. One specifically says, are mental health services available on campus via private pay for those students who have waived the LC insurance? And kind of on those same lines, is there mental health counseling available on campus?
Yes, so we do have mental health counseling available on campus for this fall. It will primarily be offered in a telecounseling sort of format. We found that worked better than getting people in a room, both with masks on and trying to have sort of a very personal engagement in a small space. So, yes, we will have counseling available on campus, mostly via telehealth. The counseling is free. So there are no copays or anything like that for counseling. Again, psychiatry, some nominal fees for that, but we really don't have very much psychiatry available, but we do have lots of counselors with lots of different credentials. We have psychologists, We have a clinical social worker. We have some doctoral students in training to be psychologists. So we have a robust counseling service. Did I catch all that one, Sherry?
I think so.
Good.
One other one that I think might be quick is about, some people are asking about just having the health insurance just for the fall, or maybe they're going to have some other type of insurance that will be available to them in the spring. So can they make a change mid-year? And I know we talked about this a little bit.
Yeah, sure. Well, it bears repeating because a lot of this stuff is pretty confusing, to be quite honest. So yeah, if you have an event, take a new job, you lose an old job, you have you wind up having a marriage in your family, something happens where there's a change in your health insurance situation, there is the opportunity for mid-year switches. Certainly at the semester, and sometimes, it depends on the event, sometimes even in the middle of the semester, it just depends. So, but absent those events, or absent a student moving from like remote learning in Texas to actually being on campus in Portland, you know, we're going to be able to make some adjustments at the semester for those situations, but we're not going to be able to, a student who is in Portland for the fall and is in Portland for the spring, they won't be able to hop on and off the planet this semester if there's not a qualifying life event.
And I think we just one more question and then I'll let you wrap up. And then maybe you have an idea for where people should go for these additional questions that they have. But one question that was asked pretty early on was, apparently there's a medical information form that needs to be completed and notarized, but they're not seeing it online anymore.
I'm not sure exactly what that question means. There's a lot of things that get mixed up here in terms of like release of information forms and healthcare powers of attorney, things like that, that are a little bit beyond the scope of this presentation. So, you know, I can give you my email, which is my last name, Hancock, @lclark.edu. And so people can send me their questions. I want to warn you that I'm taking a week of vacation next week. So I won't be responding to questions right away and not in the next week. But if people send me questions, I will get back to them. Or I have an assistant who can also get back to you too. She will be in the office next week, and her name was, her email was on the previous slide. And I'll just give you a different email that she also uses because it's the one that I memorize. It's counsel, COUNSEL, the word counsel @lclark.edu. She's my assistant with insurance. She'll respond to questions next week.
Great.
So with that, I might go ahead and wrap up. And this was this last slide. You know, what can you do to support your student about insurance issues? So I want to give you some final tips. Number one is, one of the things I did, staying in network is always to your financial benefit, whether it's with your insurance plan or whether it's our insurance plan. So before you send your child away to Portland, especially if you're sending them away from a distance, I really encourage you to sit down at the computer, go to your insurance plan's website or our insurance plan's website, and identify which hospitals around campus are in network, which urgent cares are in network, which pharmacies are in network, right? Write those down, have your student put it into their smartphone. This very thing happened to my daughter when she was away at her first year of college. She had something arise. The health center at her campus was closed. She had to go to an urgent care center in the town that she was living in. And it's like, where do I go? Where do I go? Well, because I had done the work on the front end to tell her what urgent care centers were in network, she was able to go to that in-network urgent care and keep the costs down for me and my family. So that's a really cool thing. So I encourage families to do that. Be sure that your student knows what their insurance, if students take out the student health insurance plan, they're going to get an insurance card. They can actually, it'll be an electronic card. They can access on their smartphone. They can also, I believe, Mike, still print a copy of that off the web if they want to do that. But if they're going to have their own insurance plan from back home, please be sure that they bring a copy of their insurance card with them. Be sure you talk with them about your expectations for managing insurance issues, such as if let's say they're on the student health insurance plan, right? The health service doesn't directly bill the student health insurance plan. The student's got to print out that receipt and submit it, and then they get reimbursed. If they don't submit the receipt, they don't get reimbursed. So you might want to talk about your expectations if they're going to be on the student health insurance plan, that you want them to take on that responsibility of printing out their receipts and submitting them. Reasonable thing to do as they voyage on the way to adulthood. And then very last thing is if your family, we hope our student health insurance plan meets your needs, but if it doesn't, just be sure that your student has completed the waiver by September 14th. Otherwise, they're going to be stuck with a big bill that they don't want, and I do not want that to happen. So that we ran a little bit over. I'm so sorry about that, everybody, but I hope we've answered your questions, given you some resources. Again, this video will be posted on the NSO website. I want to thank you all for joining us. I want to thank Sherry and Mike for their time today, and we're excited to have your students with us this fall. Best wishes to all of you. Bye-bye.
Bye.
Thanks, everyone.